Hi, my name is Inesh Ghanta, and today I'll be talking about Nightcrawler 2014 and how it portrays antisocial personality disorder. So, the film's main character is Louis Lou Bloom, and he is a socially isolated freelance videographer in the Los Angeles area. The setting is a modern urban American city with fierce competition in a capitalistic media culture that focuses on profits and sensationalism. The environment leads Lou to lean on violent crimes, often doing whatever is necessary to be the first on the crime scene in order to get the best angles for the news station, even if it means using the most unethical and immoral methods, which further fuels his disorder. Throughout the movie, he is seen going to further and further lengths in order to get more extreme shots to the point of committing crimes. His diagnosis of antisocial personality disorder, also known as ASPD, is characterized by a pattern of lack of empathy, impulsiveness, and an absence of remorse according to the DSM-5. Additionally, even though these are symptoms that should be diagnosed and treated, these traits actually help Lou in the context of the film, which might further reinforce these behaviors. In a cultural context of the movie, a therapist would diagnose Lou with ASPD due to his lack of concern for others and his manipulative and criminal behaviors. ASPD is not diagnosed or conceptualized identically across different cultures, and this is mainly because some cultures emphasize collectivism and social harmony amongst each other, which can make it harder to identify these symptoms of ASPD, while other cultures may interpret these behaviors as psychological disorders, and it'd be easier to identify these symptoms of ASPD and diagnose it. Individuals with ASPD are also seen as dangerous and unemotional, leading to a negative stigma around them. And this movie reinforces that stigma by showing Lou manipulating the people around him to his advantage. The evidence of him, or sorry, the evidence of Lou having ASPD is symptom one is when throughout the film he's shown lying, and that's by fake aliases or conning others, and this is more in a negative manner than just normally like lying. This is to an excessive and manipulative uh, order or way, and this is a symptom of ASPD according to the DSM-5-TR. And an example of this in the movie is when Lou manipulates the news director Nina, both emotionally and professionally at dinner, and uses her fear of ratings in order to use that as leverage against her. And another symptom Lou displays is his lack of empathy, also which is also a symptom of ASPD according to the DSM-5-TR. And an example of this in the movie is when Lou stages a shooting at the end of the movie, which ultimately gets his employee Rick to die, and Rick really um, looked up to Lou, and Lou had a choice to save Rick, but he chooses not to, and even withholds information about Rick's death to the police, which shows how he just doesn't care about how guilty he is about Rick's death, and it shows that he doesn't feel guilty. But the weakest symptom is his impulsiveness, as throughout the movie, Lou is shown as methodical and takes his time planning out how he's going to achieve his goals and manipulate others. A treatment that could work is cognitive behavioral theory, which focuses on accountability for behavior and reducing harm. And this is appropriate because it can reduce antisocial behavior and improve impulse control. And some ethical concerns of this would be low motivation for treatment and the risk that the patient might be manipulated by the therapist. And some barriers to treatment are a lack of legal consequences and inconsistent social or institutional accountability. Some broader perspectives of this film is that it portrays an exaggerated but clinically possible depiction of ASPD, and the filmmakers clearly researched the ASPD and other psychological disorders, as Blue portrays them very well, but it does not show a good job of showing them in the aspect of it shows them as evil and violent when this may not always be true. And these are my sources. Thank you.